Firstly, I'd like to acknowledge my friend and long-time friend Violet. To all of you here, she's Auntie Violet. I'd also like to pay my respects to the elders past and present and emerging. I'd like to acknowledge Thomas and Ben and say a big thank you to the Radford community and particularly the Dirrum committee for inviting me here to speak today. I've been the CEO of Winnunga Nimmityjah Aboriginal Health and Community Services for 25 years. And Winnunga kicked off at the Aboriginal tent embassy back in 1988 when the Queen visited Australia. There were 3 Aboriginal people and a doctor that set up a temporary clinic down at the Grevillea Park to look after the Aboriginal people that were coming in to protest. So from there we moved to the back of the old Griffin Centre and we had a little room there, the Shortcuts building, and used to have a doctor half a day on a Wednesday afternoon and then half a day Saturday. Then we got a permanent space in the back of the old Griffin Centre, and I don't know if anyone here's old enough to remember the old Griffin Centre. Yeah. Well, you know, Parks and Gardens used to store their rakes there before Winnunga moved in, but anyway. Then we, when I started at Winnunga, I had 5 staff. And my brief when I went to Winnunga was to actually have the clinic relocated and co-located. So we moved to Ainsley, at the back of the old Ainsley shops. Does anybody remember that old baby health clinic at the back of the Ainsley shops? And that's where, that was like a palace compared to the back of the old Griffin Centre. And then back in 2005, when John Stanhope was the Chief Minister and Simon Corbell was their Health Minister, they moved us to Narrabundah, where we had half the old Narrabundah Community Health Service building. And we still had some ACT health programs running out of that building. It wasn't long before we were allocated the whole building. So then we were able to provide dental services. We have doctors, nurses. We now have nurse practitioners. We have the Aboriginal staff that make up the social health team, the drug and alcohol workers, the mental health workers, and they provide liaison support and advocacy for our clients. So, and all the Aboriginal receptionists. The Aboriginal staff in an Aboriginal health service are gold, and they are the backbone of the service. We employ others like GPs and nurses and everyone because they bring their professional expertise. But for me, as a Aboriginal woman and Wiradjuri elder, it's about that connection to the community. And without that connection, it's hard to get the trust of the people. And I think that that's why Winnunga's such a successful service. And Auntie Violet actually worked at Winnunga years ago. And so that was a while back now. But, you know, in 2018, in the budget, the government announced that they were going to, the ACT government announced that they were going to fund a new purpose-built building for Winnunga. And after some tough negotiations and holding the line, I was able to have the funding granted to Winnunga so that we didn't have any government involvement in the build. So, and that's what self-determination is. It's about, we managed our new building, we managed the finances, we managed the builders, we managed the architects, and we employed the project manager. So every step of the way, I was involved in that build. And just before we started to build, they were setting up on the site. And we knew that we were going to have a $4.5 million shortfall. So I was lobbying the Liberal, the opposition leader at the time was Alistair Coe, and the Health Minister, Rachel Stephen-Smith, to try and leverage some funding from the Commonwealth. And 2 weeks before COVID hit, the Commonwealth announced that they were going to provide $4.5 million for Winnunga. So we got in just in the nick of time. I know COVID's blamed for a lot of things, but it worked in our favour, let me tell you. And so we worked on a construction site because the new building went up on the same block as we are, that we were originally on. So that had its challenges, but all in all, it went fairly smoothly. And so we ended up with a $20 million building. We bought it in on budget and we bought it in on time, which is a huge achievement. And so now we moved in in February last year. We still haven't had our official opening, and that is because of COVID, and we don't want to be seen as a super spreader because we just don't know where it's going to go. And it's too important to miss an opportunity to have a huge celebration when we do open the service. But, we run lots of programs, and I guess one of my greatest achievements is the clinic that we run in the prison here in the ACT, the AMC. And Winnunga's been doing prison health for many, many years. We used to go to the Belconnen Remand Centre. We went to Goulburn Jail for 10 years. And we also went to Cooma Jail. So it was just, a natural thing for us to do. Was to provide services in the AMC. But when we used to go to the AMC, we only needed a doctor half a day a week because we only had 12 men in there at that time. And now we've got around 28% of the prison population on any one day is Aboriginal, and yet we make up 1.9% of the total population. So, and the same with child protection. But with our clinic in AMC, I don't know whether you've heard of David Eastman. And he went to jail for murdering, or he was accused of murdering the chief police officer, Winchester. And what happened was he went to jail for a very long time, and he was actually spent a lot of time in prison in the AMC, but was released probably a couple of years ago now, where they found him not guilty. So it was overturned. But they gave us his old prison cell as our clinic room. So that that just goes to show how important we are and how much they actually support us. But anyway, we make it work. And for me, it's about the people that we're there to provide the service to. And it doesn't matter how we get there, as long as we get there. That's the most important thing to me. And I've always been focused on our clients. And Winnunga's services have been built around client need, not about what government's prepared to fund you for, but to hold the line to get what you need the funding for. So in the Northern Territory and remote and regional Australia, there's a need for Aboriginal health workers, and I absolutely get that. We don't have that same need here in the ACT. And my preference is for Aboriginal people to become nurses, not Aboriginal health workers. We also run a lot of programs, and some of the programs that we run a women's program We run a healthy lifestyle programs. We have dietitians, we have an audiologist, we have optometrists, we have a physiotherapist, we've got psychiatrists, we've got psychologists. So we have a lot of other allied health professionals as well. And for us, it's the way that we've had to build the service. One of our psychiatrists has been with us for 22 years. So, and she come there as a psych registrar. And even though she does 3 days a week in her private practice, she still commits 2 days a week to Winnunga. So, and psychiatrists and mental health staff are very, very hard to come by. And it's really, really important because we have a lot of clients that do have mental health issues as well as addiction. So it is challenging work, but it's very rewarding work. And the thing is that, nobody chooses to become addicted, but that's what happens, Some people, they experiment and, they can have one, do drugs once and become addicted. And for Aboriginal people, it's all that historical trauma due to the colonisation, the dispossession, the stolen generations. And Canberra's like a big, I guess for me is that Canberra's a very middle-class, well-off city for some. And I wouldn't call it a city really. I think it's much more like a big regional town. But for my people who are born into poverty and that are impacted by racism and the over-representation in the prison system, if you're an Aboriginal child in Canberra, you're around 20 times more likely to be taken into care. The problem with the system is I know that a few years ago, or it was probably 10 years ago now, that there was around $3.5 billion being spent on out-of-home care. So keeping kids out of home in foster care or in homes or wherever. And there was only $386 million being spent on keeping kids out of care. What we need to do is start to flip these things around. It costs a lot of money to keep people locked up in juvenile detention and in prisons, when really we should be working with on proper rehabilitation and proper services like mental health, rehabilitation services, working through the trauma, working through the issues, and then you've got that, on top of that, you've got chronic disease, multiple, heart disease, kidney disease, then the diabetes, and the list just goes on and on. And the thing for us as Aboriginal people, we don't have to be old to get those chronic diseases. There's a lot of young people, and I say to the doctors, if you think it's what you think it is, then it probably is. Doesn't matter how old that person is. You need to make sure that you do the test to rule it in or rule it out. So I just think there's so much work to be done here in Canberra, and I think it's great to be able to come here today and speak. But we do need to look inward. I get very frustrated when I turn up to meetings and there's representatives from the Northern Territory or WA or Victoria or someone there talking about the experiences with Don Dale and other places when we've got it in our own backyard. But people just don't want to see that. It's easier to look out than look in. And we've got a lot of young people in this room today and not so young people. And what I say is that get to learn what's happening in your own community and then look out. But you just don't have to do one thing, but please, think about what's happening here in Canberra and why all the data is going in the wrong direction when it comes to Aboriginal people and Aboriginal kids. And the government's very, very good at, putting spin on things. But I'm a truth teller. And the thing is that if they want the truth, and we're talking about, truth telling, so that we can sit down with each other and be honest about where we've come from and what's happened, and without people having to take that personally. But I think that until we all have a good look at ourselves and have a good look at the politicians and what they're actually doing, what they're saying and what they're doing, the rubber doesn't hit the road. So, it's more about the spin than what it is about the action. And like I say to people, when I die, I want people to remember me for what I've done, not what I said. And the thing is that the proof's always in the pudding. And I will walk the hard walk. I'm a hands-on CEO. If I need to support a client through the justice system because I'm the one that they trust, then I will do that. I'll always put my hand up. And the thing is, you build your service on trust. And that's why Winnunga has got such a good reputation, particularly with the Commonwealth Government and the politicians at that level, is because they know that that's where the trust of the people are. You're always going to get people that say, Winnunga's not for me. But at the end of the day, Winnunga's for all Aboriginal people. But it's their choice whether they want to come to Winnunga or not. And it's all, at least people do have a choice. There's some vulnerable people and families in our community that don't have a choice because they can't navigate the system. Because things at Winnunga, we even bring in probation and parole. We have pro bono lawyers that come into Winnunga. We have probation and parole there on a Wednesday, and we have a pro bono lawyer there on a Wednesday. So we also do work. Our forensic psychologist does work in the prison with the women and the men out there. And it's about working with them to try and give them the skills to manage their triggers, both on the inside and the outside. But you just can't go into a prison and start to peel. It's like an onion when you start to peel the layers back. You can't just rip it off because it makes people very, very vulnerable. And the thing is that we like to do our programs in the morning so that if anybody's having a meltdown or needs to talk, then we've got the afternoon to do that. So it's not just a matter of just going in there and running a program and then walking away. It's about actually staying there and making sure that people are safe and we can look after them in that space. But our clinic there is 7 days a week. So we start at 6:30 in the morning and we finish at 8:30 at night. But the bizarre thing about that is that when the women and the men go into lockdown at 4:30, we can't get access to them. So if somebody gets sick, then it's up to the officers to ring the nurse to tell them what's wrong. And I think that that's really risky, and I think that that's something that needs to change in the prison system. But also I think that there needs to be a balance between health and corrections when it comes to running prisons, because I think that here in the ACT they take a very punitive approach. And, the punishment is to take these people off the street, not to keep punishing. So I just think that if we can all think about that and think about how you might be able to assist, I've been calling myself and other leaders in this community have been calling for a royal commission into the overrepresentation of Aboriginal and Torres Strait Islander people in the justice system. And the more people that can come along with us, the better, because, you know, our kids, homegrown kids, aren't even getting through primary school, let alone getting to high school. And all the data gets out of whack because of kids coming in for boarding school or kids from interstate coming into the university. So I think that then makes the data look very different. But where I work on the ground, it's much more different to that, you know, like, so if you could all think about that, that would be wonderful. And I want to say thank you again for having me today, and I'm happy to take if anyone wants to come and see me after this, I'm happy to talk to you about anything you might want to raise with me. Thank you.